Hello, everyone. For today's dermatology question, we have an interesting case. So let's get into it. A 68-year-old man comes to the community health center complaining of a flaky and itchy scalp. He isn't sure exactly when the symptoms started, but he thinks his brother might have a similar issue. He hasn't tried any specific treatments, though he does wash his hair every other day with a mild shampoo and washes his face once daily with cold water. His medical history includes coronary artery disease, type 2 diabetes, benign prostatic hyperplasia, and diverticulosis. He's also a recovering alcoholic and has been living in a group home for the past 4 months. His vital signs are normal. On physical exam, you notice oily skin with mild redness and scaling, not just on the scalp, but also the eyebrows and ears. You can see an example of this in the image provided. During the visit, the patient repeatedly scratches his scalp and eyebrows. The rest of his skin exam is normal. Now here's the question. Which of the following is the best initial treatment for this patient? Take a moment to think about it, and feel free to pause the video if you want to guess the answer before we go over it. Pathogenesis, possibly related to Malassezia colonization and associated inflammation. Clinical features, erythematous, pruritic plaques with greasy scales. Scalp, central face, ears, chest, and the risk factors are CNS disease, example Parkinson disease, and HIV. The treatment is topical antifungals, example selenium sulfide, ketoconazole, and topical glucocorticoids, maintenance treatment required to prevent recurrence. Low-potency glucocorticoids should be used in areas with thin skin, for example face. Choice A, grisofulvin is used in tinea capitis, a dermatophyte infection most commonly seen in children, and tinea corporis, which causes annular plaques with peripheral scaling and central clearing. Grisofulvin is not effective against Malassezia species and can worsen SD. Choice B, oral antifungals, e.g. itraconazole, ketoconazole, are occasionally used in SD, but they are not first-line treatments and are used primarily in severe, refractory cases. Choice C, permethrin is used to treat scabies, which presents with intensely pruritic papules and vesicles between the fingers, as well as on the volar wrists, elbows, axillae, lower abdomen, or genitalia. Crusted scabies can cause large, scaly patches, but is not pruritic, and occurs most commonly in immunocompromised patients, e.g. lymphoma, AIDS. Choice E, topical nystatin is used primarily to treat intertrigo and other disorders caused by Candida species yeasts. It is not used in SD.